Mouth breathing is breathing through the mouth rather than the nose. During rest, breathing through the nose is common for most individuals. Breathing through both nose and mouth during exercise is also normal. A behavioral adaptation to increase air intake and hence supply more oxygen to the muscles. Mouth breathing may be called abnormal when an individual breathes through the mouth even during rest. Chronic mouth breathing in children may affect dental and facial growth. It may also cause gingivitis and halitosis, especially upon waking if mouth breathing occurs during sleeping. The term mouth breather is sometimes utilized as an insult to imply low intelligence. It has been suggested that chronic mouth breathing in children can lead to the development of a long, narrow face, sometimes termed long face syndrome, when the mouth breathing is related to adenoid hypertrophy. Malocclusion of the teeth is also suggested to result from chronic mouth breathing in children. Conversely, it has been suggested that a long thin face type, with corresponding thin nasopharyngeal airway, predisposes to nasal obstruction and mouth breathing. A long thin face may cause mouth breathing rather than the other way around. Facial form is also strongly influenced by genetic factors. A good-looking face is determined by a strong, sturdy chin, developed jaws, high cheekbones, good lips, correct nose size and straight teeth. When a face develops correctly, it follows that the teeth will be straight. Straight teeth do not create a good-looking face, but a good-looking face will create straight teeth. Each year, parents spend thousands of pounds and dollars in an effort to straighten their child's teeth, while ignoring other factors. This 10-year-old boy is a nose breather and has a good-looking, broad face with everything in proportion. In other words, everything is in its right place. The boy exhibits well-defined eyes, cheekbones, lips and chin. On the boy's 14th birthday, he was given a gerbil as a present. Soon after, his nose began to block, causing him to breathe through his mouth. Within 3 years, his face had changed its shape considerably. The above photograph is of the boy at age 17. Because he kept his mouth open from the ages of 14 until 17. His face grew downwards instead of in width. His face became narrow and long. His jaws are set back from their perfect and natural position. He now has a double chin and his jaws come back on his airways, resulting in smaller airways. This creates health problems such as sleep apnea. His nose looks far bigger because his jaws do not come forward enough, and his cheeks are sunken as his face drags everything downwards. This face is typical of the thousands of children who breathe through their mouths. Kelly was 7 years old and Samantha was 8.5 years old. Both sisters displayed habitual mouth breathing and were developing associated facial growth patterns. Kelly is to the left and Samantha is to the right. Observe the development of their faces. In your view, who has the more attractively defined face? Look at the tension on Samantha's mouth as she closes her mouth for the photograph.